I came across this amazing story about a nurse named Tanya
Oh,
who's
really?
absolutely transforming community healthcare.
Transforming how? What's she doing differently?
Well, she's taken this special training in community nursing, Borgerner Sujaplaya, and
Mm-hmm.
she's using it every day as a home nurse in Kenborg.
That's fantastic. How does that training impact her daily work?
It goes beyond just medical care. She's also
Right.
coordinating treatments and supporting patients who, might not have anyone else.
So she's like a bridge between the patients and the healthcare system?
Exactly. Many of her patients have multiple illnesses and see different specialists, and it can be
Yeah,
overwhelming for them to keep track of everything.
I can imagine. Did she have any stories that stood out?
Oh, absolutely. She mentioned this one gentleman with diabetes who was really struggling.
Oh
He just
dear,
couldn't manage his blood sugar levels.
that's tough. What did she do to help?
Well, even though her visit was for something else, she couldn't ignore his distress. So, she set up a shopping service to make sure he had the right foods
Oh,
and
nice.
arranged a comprehensive appointment with his doctor.
That's going above and beyond.
Yeah, it's like she's not just a nurse, but also a coordinator and advocate, ensuring he got
Exactly.
holistic care.
But isn't that a lot to handle? I mean, doesn't it strain the resources?
Well, her manager did mention challenges when staff are away for training, but they plan
Right.
ahead and adjust schedules accordingly.
Still, do you think it's sustainable in the long run?
I think so. Tanya believes that investing in this training is crucial, because without it,
Mm-hmm.
we risk more errors in the future.
That's a good point. Prevention is better than cure, after all.
Exactly. And she also talked about her relationship with a 94-year-old patient, Asta.
Oh, tell me
Their
more.
bond really highlights the importance of continuity and trust.
How so?
Well, during a visit, Asta asked if Tanya would be the one coming next time, and when
Aw,
Tanya assured her she would, you could just feel the relief and happiness.
that personal connection makes such a difference?
It does. It's like having a familiar face can turn a stressful situation into a comforting one, and that's
Exactly.
invaluable in healthcare.
But what about when Tanya is away for training? Doesn't that disrupt the continuity?
Well, that's where her manager, Marie, comes in. They work hard to maintain predictability,
Mm-hmm.
adjusting schedules, and bringing in support when needed.
That's good to hear. But do you think other places can replicate this model?
I think they can. It might require some adjustments, but the benefits seem to outweigh the challenges, especially when
Right.
it leads to better patient outcomes.
Speaking of outcomes, did they mention any results from her approach?
Yes! Marie pointed out that specialized nurses like Tanya help prevent hospital readmissions
Oh, that's
because they catch
significant.
early signs of issues before they escalate.
That's impressive. So investing in training really pays off?
Exactly. It's like planting seeds now to reap the benefits later, you know?
Yeah, absolutely. But do you think enough nurses are getting this training?
Actually, Tanya mentioned that she wishes more would take it because the
Mm-hmm.
demand is growing with our aging population.
That's a good point. As more people require complex care, we need skilled professionals.
Exactly. And without investing in their development, we might face bigger problems down the line, like increased
Right.
errors and hospitalizations.
It's a bit like not servicing your car and then being surprised when it breaks down.
Haha, yeah, that's a great analogy. You can't
Thanks.
expect things to run smoothly without proper maintenance.
So what's the takeaway here?
I think it's that investing in specialized training for nurses is essential,
Mm-hmm.
not just for the nurses themselves, but for the entire healthcare system.
Agreed. It's about building a stronger foundation for the future.
Exactly. And ensuring patients like Asta and the gentleman with diabetes receive the best care possible with
Definitely.
compassion and expertise.
It makes me think about how we often overlook the importance of community healthcare.
Absolutely. It's like the unsung hero of the medical world, working behind the
Right.
scenes to keep everything running smoothly.
Well, here's hoping that more nurses get the opportunity to specialize like Tanya.
Definitely. The more, the better for all of us, really.
Yeah. Thanks for sharing her story. It's been really enlightening.
My pleasure. It's inspiring to see such dedication in healthcare, and it gives hope
Absolutely.
for the future.